That is absolutely still my favorite rendition of that song. Welcome, everybody. I am sharing my screen now, so please let me know if you're able to see it by raising your hands. And all right, I see hands going up. Let's get started. Welcome to the Practice and Pregnancy Orientation. I am your host, Dr. Adams. I've met many of you already, and others of you I hope to meet soon in our history visit coming up. And I'm giving you just a moment to grab your questions because this is live, so I'll be ready to answer questions today. Before we get fully into everything, a few housekeeping items. One, this is confidential, so please don't be afraid to ask questions. No one will be able to see that it's you asking the question. I will keep everything confidential, and so if for some reason, though, it's a little too personal, I think people might be able to tell who you are by my answer, then I'll say, let's hold that one for your visit. So I invite you to participate. And then if you have to hop off at any point, you can see the rest of this on our YouTube channel. Hopefully everything is recording this time. But so if not, just watch the previous ones because I do the same thing every single time. I'll have poll questions hidden throughout here to make sure you're still engaged and paying attention. And we're going to start with one in just a moment. All right, so our first poll question will tell me who's on the line. So how many first-time moms do I have here? How many veteran moms do I have? You're going to answer the questions now. Very good. And I'll stretch a little bit and then I'll say the polls are closing in 3, 2, 1. I will end the poll and I'll share the results with you. And then we will move on to the next thing. So this time I have more first-time moms than veteran moms. All right, awesome. That helps me to figure out what I'm going to say next too on the polls. So today's topics, we're going to go over the full circle experience, which includes where we deliver. We'll go through our office protocols, talk through what to expect at your pregnancy visits. Going to give you lots of prenatal resources. We're going to go in depth on exercise and nutrition in pregnancy, and then we'll wrap up with a COVID-19 update. And the two questions that I have up here already, I am going to answer later on. So I'm going to delete those and I'm going to give you a cliffhanger. Stay tuned. We will answer those. So first, we're going to start with the philosophy of our practice. Full Circle is a collaborative midwifery model practice, which operates under the auspice that pregnancy and birth are normal life processes. This is something physiologic, something your body is supposed to do. In the traditional model of midwifery, they too were able to care for low-risk women, but if there was some abnormality identified, then you'd have to transfer out of midwifery care in order to receive access to different acuity of care. In the collaborative model, though, you're able to stay under the midwife care with physician direction. We also have physicians who have midwife hearts in terms of our approach to labor and to delivery. So if you end up delivering with one of our physicians, you still have an amazing experience, no matter how that goes. Most of the deliveries at this point, though, are attended by our certified nurse midwives. Some of you were my GYN patients before, Dr. Marrow's GYN patients, and your thought is, all right, we're just going to go in and we're going to now have Dr. Marrow and Dr. Adams or Mooney deliver our babies. If it's a vaginal delivery, you are more likely to have one of the midwives do your deliveries. If there is something outside of the scope of the midwife, like some emergency, they will call one of us. Physician consults for urgent things, like things that cannot wait until morning, but can wait about 15 minutes. But all of us live about that far from the hospital and are able to get to you quickly. If you do not have 15 minutes, where we deliver, there are OB hospitalists, board certified OB-GYNs who are in-house 24 hours a day for true emergencies, like baby needs to be out in 5 minutes. To put it in perspective, last year we did about 550 deliveries and only 3 of those did we need to use the hospitalist. And I will tell you the most common reason we need the hospitalist is not a bad emergency, but just your baby's not waiting for anybody to get in there. And someone needs to be in there to attend your delivery. So where do we deliver? Great question. We deliver at HCA Florida Hospital, formerly known as Memorial, before HCA took over. And it is located about less than 10 minutes from our office, and they do tours. So they have one-on-one tours available, but they also do these quarterly tours. And the next one actually is November 22nd. So if you're able to make that, when you come in for your visit, there are signs on the wall, on the walls in the exam rooms. You can call that phone number and register for the tour. Please register because it's super cute. It's like a baby shower. They raffle off prizes. You get to tour the unit, meet the nurses, that sort of thing. If the times that are listed on there don't work for you, though, please still call that same number and you can arrange one-on-one tours. They do them on the evenings, they do them on the weekends. They are very available to you. The office is open Monday through Thursday from 9 a.m. to 1 p.m. We close for lunch from 1 to 2, and then we reopen from 2 to 5. During the time that the office is closed, the phone rolls over to the after hours line. So the phone's not broken, we're not out of service. If you call at 1:30 and you reach the after hours line. The reason we do that is because the after hours line always rolls to the person who has the on-call phone. So if you have an emergency between 1 and 2, you're still able to reach the provider. To that end, we ask that you don't leave administrative messages on the phone between 1 and 2 because the midwife or whoever has the phone on call is not carrying the phone to send those messages back to the front desk. Wait till we reopen at 2 and give us a call then. On Fridays, we are open from 9 to 1. And so if you're calling with an administrative issue 5 minutes before closing, you may not get a response on it until we reopen on Monday at 9. We do not do walk-in appointments because our goal is to see you as close to your appointment time as possible. And if I promised you the 9:30 spot and someone walks in at 9:25 and says, I have an emergency, I need to be seen right now, we've already told you we're going to be seeing you at 9:30, and so that's not respectful of your time. And so we ask that you also respect the time of those around you. Now, people deliver, people cancel, and so sometimes we do have limited same day appointments. So if you're calling first thing in the morning, hey, I think I really need to be seen, we are usually able to find a spot on someone's schedule to put you in. Now, if it's something, say it is 9:30 in the morning, but our first open spot isn't until 2:30 in the afternoon. If it truly is an urgent matter, we're not going to say, well, you need to wait 5 hours before we can see you. We might recommend that you go to either an urgent care or to labor and delivery to be evaluated. That is not us saying that we don't want to see you in the office. It's us saying we don't want you to come here and sit for several hours waiting to be worked into one of our schedules because your urgent matter may require an urgent care setting. When you call, the providers are not able to leave our appointments to take phone calls. Again, that is the time that we have promised to the patients who are on our schedule during the day. And that is what we are doing all day, is seeing patients, just like the day when you come in to see patients. So we're not able to leave appointments. We do have a nurse who is able to field triage calls because many of the calls are the same things and she knows how to kind of talk you through certain scenarios. If there's ever something that's beyond her scope or something she's not able to answer, she will say, hey, let me get in touch with the on-call provider and get you an answer. So give her a chance to talk to one of us and get back to you. Anytime you call, though, please be sure to leave a message in order to receive a call back. And be sure you're leaving the message in the right place. If it's a nurse call, Tony is taking our nurse and triage calls. She's also the person who helps with FMLA and short-term disability. Our OB clinical coordinator is Naisha, and many of you have already had interaction with her because she sent you the email for your lab if you've had your history visit with me. So many times you'll hear me say, you're going to get an email from my OB coordinator by tomorrow close of business. That comes from Naisha. She's also the one who sends referrals if you need to see the high-risk doctors, cardiologists, hematologists, or at the end of pregnancy when you need to have something scheduled, if you need an induction, a C-section version, what have you. She's also the one who schedules circumcisions. So Naisha keeps us on track and tells us where we're supposed to be. Everyone on this call typically has met with Renee, our benefits coordinator, at your confirmation visit. So if anything changes about your insurance, I know many of you are in open enrollment right now. If you're changing your plans or have questions about which coverage would probably be better for maternity, anything like that, please let Renee Hall know. And if anything changes in January about your plan, please update us as well, as we're happy to run through again and just make sure we're not still collecting on an old prepayment plan you don't need, or that you're not surprised with a big bill at the end because you never had one. After hours, there is always someone from our practice on call for our practice. But this is the emergency on-call provider, meaning she is the person who is in the hospital taking care actively of our hospitalized patients. So this is someone you only want to call if you think you need to join her in the hospital. So you call the on-call line if you feel like you need to go to the hospital, if you're not sure if you need to go to the hospital. Please remember, you have to leave a voicemail on the phone for it to even register that a call came through. I've had the phone before, and sometimes if you go through, you can see someone called and hung up and called and hung up and called and hung up. We can't answer that phone directly. It has to go through the messages. So please leave a message letting us know what the situation is so that we can call you back. Other ways to reach us include the patient portal, but the patient portal has a response time of 2 business days. Business days are Monday through Friday, unless Monday's a holiday. So 2 business days. So if you send a message on a Thursday, Friday is the next business day, and Monday is the next business day. I know personally, my OR day is Friday. If messages are sent on Thursday afternoon, they are typically not responded to by me until Monday. If it's a non-action item, like, oh, I was just wondering whether I can eat this fruit or take this, supplement, that may be something that we pass on to the next person who's going to see you in the office because you're going to have lots of opportunities to ask those kinds of questions in person. The portal is best used for things like I lost my lab slip and I really need to get these labs done before I come back for my next visit. That's something we can email you another slip, or let's say you need to cancel your next appointment. You can message the front desk. As long as it's 2 business days before whatever action needs to take place, we're happy to take care of it that way. Things we don't want to see on the portal are urgent matters like blood pressure. So when people, and it still happens, even though I do this, go into the portal and I see I haven't felt my baby move for 2 days, and I'm like, holy cow, that's awful, because now it's been 2 more days. That's not something that should be on the portal. It cannot wait. That is an urgent matter. Please call. You're having heavy bleeding. Don't send a message about it because you're not texting us directly on our phones. We have to log into the our electronic medical record system. So don't send blitz messaging, like don't send the same message to 6 of us saying, well, I don't know who's on call or who might be looking at their portal. So I'm just going to send the same message to everyone. You may get 6 different responses and they may be multiple different things. Like one person was very upset. She had 5 prescriptions waiting for her at the pharmacy. Well, you ask 5 people to work on your problem at the same time. Give your one person her 2 business days. If she hasn't responded, she might be on vacation and you can reach out to someone else. Also, if you cut and paste messages to multiple people, we have found that it may delete your portal account because it looks like spam coming from a bot, and it freaks our EMR out and it gets rid of you. And then we also ask, please don't attempt to have a visit over the portal. So if you send a list of symptoms, an article, multiple things to review, if it ends with open-ended questions, if you're writing a paragraph, you probably need a visit. So we've spent all day in the office seeing patients. We reviewed labs, we've reviewed ultrasounds. We want to spend some time with our families now and not do 25 more little visits when we get home in the evening. So please schedule an appointment. If you have multiple things that you need to ask and they are not urgent, definitely schedule an appointment to see one of us, because that way we can talk in real time and you can get your questions answered instead of 2 business days. For 7 days we're answering one question. I do have another question here in the chat. When you call the phone number, it will not connect you to a person unless you know to press 0, which we were told at our last appointment. That is correct. If you listen to the entire message, the last thing it says on there is to reach the front desk, press 0. So you know how when you call places, it says, please listen to all the options. Listen to all the options because the last one tells you to press 0. All right, ultrasounds. Many questions I have are ultrasounds. When are we going to get one? So ultrasounds are also communicated over the patient portal unless there is something urgent. And that way we will not let you leave the building unless we give you a plan on what's going to happen on that ultrasound. Otherwise, the medical assistants download the reports from the ultrasound machine, upload them to our electronic medical record system, divide them among the providers, then we review them and send them out to you. So again, we ask that you give us 2 business days to receive them, review them, and release them to the portal. Our goal is for you to have an appointment on the same day as your ultrasound visit so that we can get a preliminary view. Like if you're waiting to see, is my placenta in the right place this time? You wouldn't have to wait 2 business days to find that out. If you have an appointment the same day, we can give you the preliminary answer. Hey, this thing that we were following up, here's the answer for that. Otherwise, if you're not able to have an appointment on the same day, then just give us a chance to get the report. I know sometimes you'll see Taylor or Kathleen typing away and you think, oh my gosh, they're typing a lot of things. Let me send a message and find out what's on my report. We don't know yet because we don't have it until it gets downloaded and distributed to one of us. Quest also has a patient portal, very efficient, very annoying, because they give you access before they even give us the results. And then you get the results and you see all this red on your paper and it freaks you out. So first thing I want you to know is that red on your results doesn't necessarily mean abnormal. They say red meaning it's out of range, out of reference for people who are not pregnant. In pregnancy, the reference ranges are different. So sometimes there are things that are not normal outside of pregnancy that actually are part of the physiologic changes of pregnancy. So give us a chance to receive the labs from Quest, review them, and release them to you with our commentary. Now, if you've had your Quest labs for over a week and you haven't heard anything from us, then it's okay. Like reach out and let us know. Hey, I've had my Quest labs for a little bit. Don't, do you all have them yet? Not the same day, not the day you get them done, not when you come home from the lab. Just want you to know, I got my blood drawn. Just want you to know it's been 24 hours since my blood was drawn. Just if you've had them for a while, let us know. Don't send them to us in your message. Let us get them from Quest so that we can get all of the appropriate information. One of the things that stops us from getting your labs on time from Quest and other facilities is if you use a different name at that facility. Our electronic medical record systems matches your first and last name, date of birth, sometimes phone number, address, and things like that. If at Quest you are Jane Doe and at our office you are Jane Smith, Jane Doe's labs are not going to sort into Jane Smith's chart. So we ask that you please use the same name at all facilities, and that name ideally should match your insurance information too. If you're using a different name, because I know some of you, you're engaged, you're getting married, you're going to change your name, and in your heart, you're already a Smith, but in your insurance, you're still a Doe. So please use your Doe until your insurance matches your heart. Alternate names almost guarantee that your results are going to be delayed. All right, and I see there is another question here. For test results, Quest or Full Circle, is there a way to make sure the sex of the baby is not released automatically? This sounds like someone who has not had a history visit with me yet, so I do go over that in the history visit if there's a desire to not have the sex of the baby released in that. So just hang on until your history visit, and we will go over what the protocol is for not releasing the baby's sex in the genetic testing. All right, what to expect at your prenatal visits. So, wear loose, comfortable clothing because at every visit, we will listen to the baby's heartbeat. Not necessarily do an ultrasound, but we will use the Doppler to take a listen to hear that baby is okay every single time. We ask that you arrive a minimum of 5 minutes before the scheduled appointment time, so you'll have time to check in, handle any business with the front desk. And if you need to leave a urine sample, you can do so. Not everyone routinely has to do a urine sample anymore. The American College of Obstetricians now says we only need to check them if we're actually following up on something. So if you have blood pressure issues and we're looking for protein, blood sugar issues and we're looking for glucose, or you had a recent urinary tract infection, front desk will know, your medical assistant will know whether or not we need a sample. Otherwise, we know you're pregnant, you've been drinking your water, and you've been driving around and you need to go to the bathroom. So if you need to go, please go ahead and go. Do not hold it until your appointment time. Have another question up there. Do you go over referral to rock in the patient history appointment? Yes, yes, I do. Those are personal things. So we do go over that in the history. So the purpose of the history is to identify if there's anything out in your pregnancy that makes any different from what we would normally do in a pregnancy. So if you're 10 minutes late to your appointments, we still have time to check on you. We check on your baby, but obviously it leaves less time for your questions. We ask that you start a text thread with yourself with your questions, because as soon as you hear that baby's heartbeat, I promise you, you're going to forget every question that you had coming in the door. So start your text thread. I have been loving recently when I go in to see my mamas, they're like, okay, we're ready for my questions. And they pull everything up and it's fantastic. You will have less time for those questions, though, if you are more than 10 minutes late. If you're 20 minutes late, you have missed the entire appointment slot. And remember that thing where we try to see you at your appointment time? We're trying to see the person after you at her appointment time as well. So we just ask that you be respectful of the next person's time. If there's another visit, front desk is really good. Sometimes they're looking at the clock and they're like, she's going to be 14 minutes late. There's a spot on this other schedule over here that she could slide into and get her full 20 minutes. They may have already rescheduled you to the next slot when you come in. Well, let them go ahead. If that's not a good time for you, it's okay. We'll just reschedule it to another day or another time that works better for both parties. Because our goal is for you to get your entire appointment time. We don't want you to come in 14 minutes late and only get 3 minutes to talk to us because we need to see the next person. Our goal is for you to have all of your time with us. So the next thing is diagnostic ultrasound visits. So when do I get another ultrasound, Dr. A? That was so much fun. Yes, diagnostic ultrasound appointments are separate from your prenatal visits. So these visits we were talking about were with the providers, the midwives or the physicians. So the way to know whether or not you have an ultrasound scheduled, or you're expecting an ultrasound at this visit, is to look in your portal and see, do I have more than one appointment time, and is there a provider's name associated with my visit? So Tina Test, my imaginary patient, logs into her portal and she clicks on the appointment button. And Tina sees that she has a 9:20 appointment with ultrasound, which is not a provider's name. And then she has a 10 o'clock appointment with Dr. Yeckel, which is a provider's name. So Tina knows, let me bring my family in for the 9:20 visit so they can see the baby. And then if they want to stay and hear the preliminary report with Dr. Yeckel, that should occur at 10 o'clock. If she does not see an ultrasound on this portal, Tina does not have one scheduled because Dr. Yeckel does not do ultrasounds. Our ultrasound techs do. And remember, the results of those ultrasounds will still be sent to the portal within 2 business days, even if we review it with you at the visit. If there is something urgently abnormal and you don't have an appointment on that same day, we will still not let you leave the building until we discuss urgently abnormal findings and create a plan for them. So when you're checking out from one visit, let's say you're 16 weeks and you have your anatomy ultrasound coming up in 4 weeks, and Jane says, hey, you need to schedule your anatomy ultrasound. When you go to front desk, Jane will have sent a message up there, but be sure you're getting 2 appointments with 2 separate appointment times, a prenatal visit and a diagnostic ultrasound visit. If you need to see your baby more than medically, we need to see your baby because we only look when we have a medical reason to. If you want to see your baby just for fun, because it's your baby. Boutique ultrasounds are fun ultrasounds that are done at places out in the city. There are a couple of them listed here just for informational purposes, but I tried to get one in multiple different areas. I know there's one in St. Augustine too. But just know that these are definitely options that you can go. They have really cute little things. They put baby's heartbeat in a stuffed animal. It's super cute. So just know that's an option that you can do at any time during the pregnancy. So the next thing we have is the poll question. All right. When should you expect routine ultrasounds? And routine ultrasounds are routine. That means there's nothing wrong. So if you can see the poll, please go ahead and answer it because the poll will be closing in 5, 4, 3, 2, 1, and we're done. All right, sharing the results. Oh my gosh. I think it's maybe the first time in all the years I've done this that everybody got this question right. Yes, at 20 weeks is your anatomy ultrasound, 40 weeks is your due date. So if you go past your due date is when we will start doing additional ultrasounds to make sure that it is safe for you to stay pregnant. Oh man, this is a red letter day. Okay, so I am going to share a different screen, so give me just a second. All right, let me know when you are able to see the website. Raise your hands for me. Okay, cool. All right, this is fullcirclejacks.com. This is our website, and lots of good information out here. For those of you who were with us and delivered at Ascension before, if you are wondering why we are no longer at Ascension, I did hold a town hall about a year ago. with all the information on why we moved to HCA. It has been over a year since we've been there. We've done over 500 deliveries there, and it has been a really, really good move. Lots of very happy patients, and it's just it was really it was the right thing for us at the right time. So, who moved? All of us, me. There I am. We'll start with our providers. So there's me, there's my buddy, Dr. Merrill. There are my friends, Dr. Yeckel and Dr. Mooney. And the midwives, we have midwife Lauren, midwife Krista, midwife Cindy, midwife Dawn, midwife Missy, midwife Jane, and we have our PA, Vanessa. Vanessa does a lot more of the GYN or problem visits here, but you may see her if you are doing a scheduled belly birth, which we'll talk about a little bit later on. So there's some info in our bios down here. You can click and learn a little bit more about each one of us. Over here under patient information, you will see the obstetrics tab. And under obstetrics, you will see lots of good stuff. You'll know you're in the right place because you'll see the growing belly and the baby at the end. But these are delivery stats. So these go back, I think, to 2018, every year telling you what our C-section rate is, our VBAC rates, all of those sorts of things. We're very transparent with our numbers. Some years are better than others, but most years are very good. We're going to start here with the prenatal care timeline. So the prenatal care timeline is where you can find what to expect at each visit. And the next question I have here is, what is the time window for ultrasounds for twins? Very good. And the next question is it okay that I missed the last question? I had my screen sideways. It's fine. I will not hold it against you. The time window for ultrasounds for twins, we're going to actually go over right now. So routine ultrasounds, you'll see listed on here as well. But let's start out at the beginning. Usually we do pregnancy confirmations between 8 and 10 weeks. And that is an ultrasound. You usually have a visit with a midwife on the same day where you go over it, discuss what the what your due date is, and if there are any urgent or pressing things. They usually show you this website to just so you can see where a couple of things are for some common discomforts of pregnancy. Then in about a week or two after that, you usually will have your history visit with me. And that is a virtual visit where we go over your medical history and identify any risk factors in your pregnancy, like you're having twins. Then we determine if, based on your history, there's any additional blood work besides the standard blood work. So this is our standard blood work: blood type, blood count, serologies, and a urine culture. We do have lab transparency here. I've had people transfer in and they're like, I'm not really sure whether they check this or check that. On here, you'll be able to go through and see whether or not you had these labs done specifically and or whether you opted in or out of some of the optional testing. You meet with the billing coordinator as well, and then you are scheduled to come back 4 weeks later. So at this point in pregnancy, we're seeing you every 4 weeks. Some of you, when you have your history visit with me, decided to opt in or out of your genetic testing, and we talk about what the options are, and you let me know what your thoughts are there. At the physical exam visit, we complete the prenatal panel with cervical cultures. The Pap test isn't actually part of the prenatal panel, but you do have the option of getting it done since we are getting cervical cultures. That's totally up to you. You do not have to get a Pap test done at that point. If you have a high risk issue like twins, this is when we would place your referral to the high risk doctors. Then we see you back here. And when you go see the high risk doctors, they will usually take over doing your ultrasounds. And so they'll determine what your ultrasound interval is. If you have a different high risk issue that you're able to stay here with us, we go over what your ultrasound interval is based on what your diagnosis is. So about 4 weeks later, you come back, we do a second trimester belly check. We talk about round ligament pain. This is when you start feeling the baby move. So that's really kind of cool. And then right around 20 weeks, we do the anatomy ultrasound. You'll see here in the middle too, this is when we try to time our first mental health screen. So those who have a history of anxiety or depression, we already know that you are at risk, but pregnancy does have its own individual highs and lows. And so we want to make sure that we're getting in front of identifying people who are at risk for postpartum anxiety and depression ahead of time so we can start getting the tools in place before the baby gets here. If you're meeting with a midwife around your ultrasound visit, you're going to start your childbirth education conversation and your lactation classes. These are the classes where they tell you what to do when the baby arrives. So they're very important. Then 4 weeks later, glucose test. I know there are lots of questions about glucose tests. I will definitely go in depth about that a bit later on, so just hang on to those questions. For my moms who have Rh negative blood type, which we found out up here in our standard labs, we're going to make sure you have RhoGAM to take around 28 to 30 weeks. This is when we want you to pre-register at the hospital. For those of you who were at Ascension before and used to fill out the packets and mail it out into space, everything is online now, so you're able to get your confirmation that your registration is done in real time. We want you to make sure that you know where the hospital is, so please go take a tour. And if you plan on working with a doula, which we'll talk about in a bit, you want to have her selected by your third trimester. This is when we start seeing you every 2 weeks. So you'll see in the middle here the option to repeat or decline your standard prenatal labs. The American College of Obstetricians recommends doing it at least once. Duval County Health Department, which takes care of different risk stratifications of populations, may recommend doing it again. If you feel that you are low risk and would like to opt out of repeating those labs, then just sign the form that states I was told and I declined. For those who intend to do their third trimester vaccinations, we don't do them here in the office physically, but we can discuss with you what the recommendations are from the CDC and ACOG and help you get prescriptions or connections with Minute Clinic or your primary care to get that done. For my veteran mamas, decide if you're staying with the same pediatrician. For my first time moms, it's time to start shopping for a pediatrician. For those who have certain complications with their pregnancies and are able to still stay in our care for high risk testing, additional testing, we start doing that between 32 and 36 weeks, again, depending on your diagnosis. Then we continue with the every 2 week visits. For my moms who know that they are having a belly birth for whatever reason, we already know that a C-section, that's our term for C-sections, belly birth, is going to be scheduled. You'll already be seeing Vanessa, the PA, because she will typically be scrubbing into your C-section to first assist. And so we'll be helping you get your date right around 32 to 33 weeks so you can start your planning. For those who are waiting for labor, we continue and we start with every week visits. Group beta strep is done around 36 weeks, and we'll explain what that is and why at the visit. If you've opted out of your repeating STD panel, you can choose to opt out of repeating your cervical cultures as well. So when we start your weekly appointments, you are full term, yay, 37 weeks. And this is when you can bring your birth plan in and we talk about it, start your natural cervical ripening methods, which I'll show you in a little bit. My belly birth moms are usually all out by 39 weeks. Sometimes it can be as early as 37, again, based on your diagnosis. If you're waiting for baby to give the signal for labor, be patient because babies don't have calendars. But we do like to have all of our guests out by 42 weeks. So for first-time moms, we like to schedule labor induction at 41 weeks and 5 days. For second-time moms, 41 weeks and 6 days. Because first-time moms, the average length of labor for a first-time mom is 24 hours, 24 hours. And if we're doing an induction, it may take us 24 hours to get you into labor. So 48 hours is not an unreasonable time for length of labor induction for first time. Second-time moms, it's usually half the length of that, so you get half as much time. All right, I have some questions out here as well. I did not have any blood work at my 8-week visit. No, you didn't. When you have your history visit with me, that is when we will order your blood work. If I had a PAP in the last year, do I have to get it done again? You do not have to get a PAP done at that visit at all. But if you're due for one, you're welcome to get it done then. Next question is, I'm pregnant with twins, but wasn't referred to high risk. Do I need to do this? I don't think you've had your history visit with me yet, and that's when I do the referral to high risk. And the next question is it a problem if the history appointment isn't until the second trimester? Typically, we like to confirm your pregnancy earlier so that we can do your history visit earlier. But if you met with the midwife already, she would have identified anything that required you to have a history sooner. If you think you have an issue that you know from maybe a previous pregnancy, that should be sooner, then definitely let me know. I am trying to delete questions because they're backing up and I don't have a host today to get rid of them for me. So hopefully all of these are not showing up for you as I do this, but we're going to go to the next poll question actually. If you had a headache during pregnancy, are you more likely to meditate, medicate, or evacuate? Get out of your house and go to the emergency room because your headache is terrible. Polls are closing in 5, 4, 3, 2, 1, done. All right, this time we have more meditators than medicators. I will tell you, before children, I probably did more meditation than medication. But now it's Tylenol usually. All right, many of you have said you've had some issues and you are concerned you don't want to take anything because you're pregnant, you can't do anything, you just have to suffer. Not true. There are many relief measures that you can employ for a lot of the common discomforts of pregnancy. So here under safe medications in pregnancy, you'll find not just medications, but here's an alphabetical list of common discomforts of pregnancy: constipation, congestion, hemorrhoids, all the sexy things nobody told you were part of pregnancy. So if you send any of us a message on the portal, the first thing we're going to say is, have you tried everything on the website? And we will send you the website to make sure that you have tried everything. Because and some of y'all are getting slick now. Dr. Adams, I've already tried everything on the website. What else can I take for blah, blah? And that's what we want you to do. Just exhaust all of these things first. And if you still do not have relief, definitely reach out to us. Because there are many things on here, including things we want you to stay away from. If you have diarrhea, do not take Pepto-Bismol. There's some caveats for nausea, vomiting. If you can't keep down fluids for 24 hours, please don't keep trying everything on here. Please reach out to us because you can put yourself and your baby in a lot of harm with that type of dehydration. So just remember that this is out here, and we'll refer to it a little later on as well. Gestational diabetes screening. Remember, I said I was going to be talking about this later on in the talk. This is not that time. Just remember that this box is out here though, and I will refer to it a little later on. We will talk about weight gain in pregnancy because some of you are very concerned that you have not gained any weight during pregnancy, and that's okay. And some of you are concerned because you gained too much weight already in your first trimester. So when you open this up, you will see that this, let's try to make it bigger. You'll see that there's a link here where you can type in your height and your weight, and it will allow you to calculate your pre-pregnancy body mass index. Whatever that number is gives you what your recommended weight gain is for pregnancy. And you can see in this last column, the rates of weight gain are in your second and third trimester. So your first trimester, all you're craving are carbohydrates. You're so disappointed in yourself. Take a deep breath. It's fine. Everybody craves carbs in their first trimester. It is survival mode. Eat what you can, stay alive. Second and third trimester is when you get your first exercise in parenting and telling your baby, no, you cannot eat potato chips all day long. So you start eating some vegetables, you drink some more water, you feel better about yourself and your ability to parent, and you rein in the weight gain in second and third trimester. So what you're eating right now kind of tempers what's happening with your nausea and decreased appetite. Don't worry, those things will come back. Your appetite will come back, your nausea will go away, and you'll be able to make better choices about what you eat in that trimester, in the second and third trimester. Birth preferences, we're going to click on that one as well. So once you hit that 37-week mark, you are full term. Your due date is 40 weeks, but full term is 37 weeks. So that is when all bets are on. So you are able to take a look at what things are most interesting and what's most salient to you in a birth experience, how long you want to wait before induction, what you want to wear in labor, what you want to do for relief of discomfort with your contractions. We do not starve you. We don't strap you to the bed. We want you to move around, and you can labor and push and deliver in any position. Like our standard is usually delayed cord clamping and immediate skin to skin. We do perineal massage, try to protect from severe lacerations, all of that sorts of things. So you can just see on here box by box. There's the routine medications that are offered to the baby. You can always, bring this list in and say to your midwife, hey, I've been looking at this. What is this? Does this apply to me? Do I need to do this or consider it? Even down here, if you're having a son and you're planning a circumcision, all of these different things. Twins are on here too. So see, you have belly birth choices and twin choices as well too. So it may seem like a lot, but just know it's 21 boxes. All the boxes don't apply to you. So you can take one box per week, most people, and be able to complete this before you reach full term. Cervical ripening techniques I also referred to after the 36th week. There are lots of things to do, but you can start red raspberry leaf tea as early as 20 weeks to help to tone the uterus. So just week by week, you see what things we recommend. These things do not put you into labor, but they help to soften the cervix. They help to thin the cervix out so that when baby gives the signal for labor, your uterus and your cervix are more responsive. So you see the breast pump on here as well, somewhere right in here. So if that's something that you're choosing to do, that is not an induction method. That is something to do at home before you get to the hospital. So if you need to be induced for something, you can definitely try the breast pump at home. But once you get to the hospital, we don't typically do the breast pump. Like that's an at-home technique. Cervical ripening is listed right here on the same line. So just remember that this is out here. Now, the other question I had was whether or not we have anyone on the line who is trying for a vaginal birth after cesarean. The next question I have is my last son had his cert done after being discharged at your office. Is that still standard or is that done in the hospital now? No, it's not in the hospital. It's still at the office before he is 10 days old. All right. And the polls are closed. 3, 2, 1. Boom. All right. So you see there are only two choices. Either it doesn't apply to you or yes, and you're going to rock it. So I do have some VBAC moms on the phone, and I know I have a lot of first-time moms. You all are basically trying for the same goal. You're trying to avoid an unnecessary cesarean. So sometimes you cannot avoid it. Sometimes babies are going to baby and they're just going to ruin your birth plan no matter what you tried to do. But control what you can. There are some things that you can do to make yourself a great candidate for a vaginal delivery. So some of these are for my VBAC moms, the fear release mediator if you're struggling with a previous birth experience. For those who are seeing chiropractors, we'll talk more about that a little bit later on, but you can see yoga, Pilates, squats, good doula, don't gain too much weight, gain the recommended amount, acupuncture, acupressure. Trust us, if we're a practice that puts our stats out very openly, it is not our goal to have a bunch of unnecessary C-sections. So trust that what we recommend to you is for you to try to preserve your safe vaginal delivery. That is our goal for you as well. So first-time mamas and VBAC mamas, remember that that is out there with your name all over it. And then here, circumcision care, to answer that last question, they are done in our office up to 10 days. Unless it's a preemie, we give them a little bit longer, and that's obviously on a case-by-case basis based on when he was born. All right, so now we're going back to the presentation, and hopefully you're able to see that. Okay, now, those of you who are concerned about how much weight you've already gained and you're saying, I'm not sure what I'm doing differently, Dr. A. I'm only having coffee in the morning, then a little fruit in the afternoon. And are you having coffee or are you having a salted caramel mocha monstrosity that is so delicious? And did you know pregnancy only requires 300 additional calories per day? 300. It takes 10 calories to maintain 1 pound of body weight, and your goal weight is based on what your starting body mass index is. So if you're starting your pregnancy at 170 pounds, it takes 1,700 calories net to maintain that. If your goal weight gain is 25 pounds, that's 250 additional calories for a total of 1,950. Divide that by breakfast, lunch, and dinner, you only need 650 calories per meal. So if you eat your 650 calories, you cannot then wash it down with a 570 calorie mocha monstrosity. I have a question here. I had a VBAC with you for my second child. Does this one still count as a VBAC? Yes, this does still count as a VBAC. And I'm not certain if you've had your history visit yet because we do discuss specifically what the risks are for the second VBAC. And we'll do that at your history visit because that is specific to you and your situation. So this slide kind of helps to remind us that making small changes can make a big impact. So especially over here on the right side, substituting herb-infused marinara for traditional spaghetti sauce can save you 500 milligrams of sodium per serving. That's huge. Limiting your fats, getting enough protein and vitamins, and then just making sure that we have the right amount of carbohydrates and all other sorts of things. You want to eat your fruits and veggies and whole grains, your cereal, nuts, dairy. For my coffee drinkers, please be sure that your caffeine intake remains under 200 milligrams daily. With the reminder, if you're drinking that much caffeine, it is a diuretic. So please be sure that you are drinking 3 times as much water as caffeinated beverage so that you don't dehydrate with your caffeine. Caffeine can also cause irregular heartbeats in babies in the third trimester. So just keep in mind, we may be asking you to discontinue it if we develop that in third trimester, or you can avoid it altogether. Start weaning early. Herbal teas are fine, and some of our favorites are raspberry leaf, ginger, lemon, and peppermint. For my vegetarians, pescatarians, you want to make sure you're getting about 70 grams of protein daily. Please do not follow these pregnancy diets that tell you to cram in 120 grams of protein a day. You will grow an 11-pound baby, and that just adds another layer of complication to our story. 70 grams is perfect, and that is even if you have twins, that gives enough for you and gives enough for each baby. You can have deli meat. Just be sure you're microwaving it for 30 seconds prior to consuming it. It does not have to be piping hot, fresh out of the microwave. Don't burn your mouth, but be sure you kill the bacteria with 30 seconds of microwaving. Soft cheeses are fine if they're made from pasteurized milk. So if you're at a restaurant and can't verify that it's a pasteurized milk cheese, which most restaurants probably aren't taking that chance, but if you can verify it, and skip the brie for the evening. But if you're at Trader Joe's, flip it over. If it says pasteurized milk, you're good. Canned tuna, you can have up to 3 4-ounce cans per week. Again, my pescatarians, if you need more fish than that, or if you just like fish and you just want more fish, the FDA has a really nice document. I know it says October 2021, but this is the most updated version of this document. For fish, you want to eat in larger quantities because they're high in DHA, which is good for baby's brain development. Fish you can eat in moderation, and those you want to avoid or eat sparingly due to likely methylmercury and things along those lines. So things you want to avoid, undercooked fish. So sushi lovers, oh, I'm so sorry. That was my one thing. I wanted sushi as soon as I had my baby. So undercooked meats and fish are a no during pregnancy. Kombucha, kimchi. Sauerkraut can be cooked, so you're okay there. Alcohol, so fermented beverage, fermented foods like kombucha and kimchi, you want to avoid things that have been fermented, like alcohol. Even alcohol-free wine actually has alcohol in it. I don't know why. So those things we don't know what the safe amount is, so we just don't recommend them at all. And you want to limit your sodium to 1,500 milligrams per day. Think back to your herb-infused marinara as you try to avoid that. All right, next question. Calorie differences for twins. Hold on. You hold on. I'll come back to that. Can you have protein shakes to get in enough meals? Any specific kind? No, 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 no specific kind. You just want to watch the carbohydrate amount in it. Don't have something super sugary trying to get your protein. And yes, you can have protein shakes, but just watch your total protein intake. And is sourdough okay since it's been cooked? Yes, since it's been cooked, you are okay. Just nothing that is raw. And the calorie differences for twins, your weight, your total weight gain, again, it still goes back to your body mass index, but you can add 10 pounds onto the upper limits for the twins. So it's not the calories specifically, but the starting body mass index. All right, good questions. Exercise and pregnancy. Okay, it is just fine for you to continue whatever pre-pregnancy activity you were doing, unless your pre-pregnancy activity was couch surfing. You just won't feel like it in your first trimester. Second trimester, you're going to increase your blood volume by 50%. That will add more oxygen, tension, and saturation. You'll get more like energy. Those second trimester physiologic changes will accommodate you doing more aerobic activity. So just listen to your body. You will suddenly feel like you're able to do more and more and more. If you weren't doing anything before, no judgment, but it is okay to start a new regimen. It is okay. It is recommended that you start a new regimen. A sedentary lifestyle leads to a malpositioned baby, and that is the most common reason we do C-sections these days. It is not big baby. It is not baby in distress. It is a malpositioned baby. So sunny side up, crooked head, because mom has not been moving her pelvis to get baby to descend appropriately. Your resting heart rate on these cute little Fitbit watches, they're giving all y'all anxiety. It will raise 10 to 20 beats per minute. That is a normal physiologic change of pregnancy. If you are not getting dizzy and passing out from it, that is just fine. If you are walking as your exercise, walking is considered exercise if your heart rate is in the aerobic zone, which is 70% of your maximum heart rate. Your max heart rate has to do with your age. It starts with the number 220. So let's say you're 30 years old. You start with 220, subtract 30, and your max heart rate is 190. So you should not be exercising with your heart rate above 190 for extended periods of time. 70% of 190 is 133, and that is where your aerobic zone begins. So if you are exercising with your heart rate between 133 and 190 for 30 minutes, 3 times a week, then your walking is exercise. If when you are walking, your heart rate is still hanging out at like 85, then your walking is transportation. And that's okay. Transportation is good too, but you still need to add in some exercise then. So exercises that are safe for you. Cardio, if you like the treadmill, go for it. Elliptical, yes. Running, absolutely. Swimming is actually my favorite. And you guys are my winter crowd, but if you can find an indoor or a heated pool, go for it. It makes your belly weightless and your joints feel so good. Indoor bikes, if you guys are Peloton users, I am off my meds 8, and I have some really cool friends we follow and keep each other honest, put blue dots on the board. If you were lifting weights prior to pregnancy, it's fine to continue with that. You can lift up to your pre-pregnancy level. You do not need to increase your resistance as your baby or babies, and your body will be doing that throughout pregnancy with the weight gains. Squats, you want to do a minimum of 50 per day. So if you're already doing 50 or 100 per day, yes, go for it. If you are an inexperienced squatter and you're just starting, 20 squats a day, or 5 squats a day at 20 weeks, then 10 squats at 21 weeks and 15, and you're building up to a minimum of 50. Pilates and yoga are actually also two of my favorite. Any exercise that stretches out that pelvis, makes those muscles and tendons long and lean, and any experienced instructor will be able to tell you what the pregnancy modifications are. Things you want to avoid are high intensity interval exercises after your first trimester. It is not the interval, it is the intensity. So you can do the low impact version of all of those. Anything has you lying flat on your back for extended periods of time, like excessive ab work. You can do side lying abs, you can do standing abs, but just not anything that has you exerting yourself and lying flat on your back. Hot yoga, unless you are a hot yoga instructor and are fully acclimated to that environment, you will get dizzy and you may fall. We don't want that to happen. Scuba is advised to avoid because of the decrease in barometric pressure and oxygen to the baby. Same thing with high altitude hiking. So altitudes up to 8 to 10,000 feet, 8,000 feet with no exertion, with exertion, 10,000 feet with no exertion. So you can visit your family in Colorado, just don't go hiking with them. Contact sports, please don't start doing kickboxing. We've had some pickleball incidents here recently. So anything with, sport balls flying at your belly, try to avoid that. Outdoor biking after 16 weeks isn't a no, but just remember that at 16 weeks is when your center of gravity changes. You start getting these little wobbles sometimes. And that is when you can actually tip over as you're trying to turn corners. Your gravity has changed. All right, so we have another poll question. Now that we talked about diet and exercise, can you prevent gestational diabetes with diet and exercise? Prevent is the key word here, and the polls are closing in 5, 4, 3, 2, 1. Polls are over. All right, so my veteran moms who have done this with me before know that the answer is no, you cannot prevent it. But you can manage it with diet and exercise, but you cannot prevent it. And that is why we screen everybody for gestational diabetes, because your number one risk factor is your placenta. You know how every other time in life we blame our hormones for everything? This is all about hormones. Gestational diabetes is it only occurs because your body, your placenta is giving off hormones that tell your insulin not to do its job. The job of insulin is to clear your bloodstream of glucose. So if your insulin is not doing that, you have excess glucose circulating in your body, which is diabetes. So this is gestational diabetes. It is diabetes related to the fact that you have a placenta. And if you have twins, you have 2 placentas. So I'm absolutely not going to not screen you for gestational diabetes. For my moms who say, but I never eat anything with sugar anyway. You eat fruits, you eat whole grains. Don't avoid your good carbohydrates prior to the test. If it is the actual drink that you don't love, we have options. So there's the Simply Pure drink for sale at our office. It is soy-free, it is dye-free, it is gluten-free, it is BVO-free, kosher, vegan, offensive to almost nobody. It is just glucose. The other patient-driven options, remember that little box that I said, I'm not going to click on this, but I'll refer to it later. Back on our website, you will see the options for fresh test, glucoorganics, and or glucose tablets. If you plan to use one of these, please let your midwife know so that she can put it on your lab slip that you're bringing an outside source of glucose and you are not able to go to Quest because Quest does not accept outside sources of glucose. We'll send you to LabCorp and you can have it done there and give you the instructions like don't drink it before you get there, all that other good stuff. Preparing for birth, childbirth education classes. So for those who are looking for method classes like hypnobirthing, hypnobabies, Lamaze, those sort of things. Again, these are just some ways to start. Bradley method. These are just some places to start. There, you can do your own search around and take a look and see what else is out there. But this is just a good jumping off place. This is not just for people who are looking to have an unmedicated birth. If you're just looking to delay the epidural so that it doesn't increase your risk for C-section, method classes are a great way to do that as well. Preparing for birth, breastfeeding classes, there's La Leche League, and there are also classes at HCA. We can give you information on those too. Every new parent should know CPR. And even if you already know it, it is not a bad idea to do a refresher course too, to at least get the little cards to hang up on the refrigerator around the house. If you're already seeing a chiropractor to help with baby's position, be sure he, she, or they are Webster certified. That is a special pregnancy certification that deals with the changes that pregnancy makes to your body so that they can make the appropriate adjustments for that. So the next question I have is who plans on working with, who plans on working with a doula? Looks like this poll. All right, it's not letting me launch it, but I'm going to assume that you all are amazing and that you are all going to work with doulas. And so we're going to talk about what doulas are. Doulas are amazing. They provide emotional and physical support before, during, and after pregnancy. So reminding you how to breathe because like contractions make you forget that you're supposed to be breathing again and again and again. They help you get into positions that help to manipulate baby's presentation and relaxation strategies during labor. They're not giving you medical advice. They're not providing medical care. They're helping you process your feelings about the recommendations from your medical team. They don't prescribe medications for you and they're not delivering your baby. Wait a minute, I have a doctor and a nurse and a midwife and a doula. Who are all these people? Yes, it's like you're going to the Oscars. You have a team of people working on you and each person has their own necessary things. So ask the midwives for recommendations for the best doulas. The ones that we love are the ones who like come to your house when contractions start. They stay with you until that baby is latched. They help you get in different positions. They're there for pushing. They are the ones who support our mamas the best. We also recommend acupuncture and pregnancy massage that helps a lot with nausea, with weird random back pains and things like that. So when you come out of the bathrooms in the front, there are business cards up there that you can see, and those are all people in the community who specialize and do work with pregnant women a lot. Question here. I'm 16 weeks with twins and transferred to your office. I had my first appointment yesterday. They scheduled me for another ultrasound and OB 4 weeks out. No mention of history. Meeting was discussed. Should I call the office admin tomorrow to discuss? Yes, I think you need to call the office. I'm not sure whether you had a meet and greet, because if you had a meet and greet, that was your history visit. You may not have one with me if you had a meet and greet as a transfer in. Most of your insurances will cover breast pumps. Even if you got one in a previous pregnancy, you can get another one. This is a whole new baby or whole new babies. Please do not go looking for your own company to supply the breast pump. We have found one that makes it really easy for you and really easy for us. So scan the QR code that is in the exam room and fill in your insurance information. They will check your insurance, tell you which pumps are covered. You pick your pump. They write the prescription, send it to us. All we have to do is sign it and fax it back. You will typically get your pump within about 2 to 3 weeks. So if you do it around 20 weeks, you will have it and plenty of time to welcome your little one or ones. If you need FMLA paperwork filled out for intermittent maternity leave so that you're able to come to your appointments or so that you're able to take your up to 12 weeks of unpaid leave at your office, we are contracting with Leave Guru, a third party vendor, and Tony would be the one to connect you for that information. For any of you who had to go through this in previous pregnancies or with previous offices, you know, return time or turnaround time is usually around 2 weeks for this. Through this vendor and this app, most of the forms are done in less than 24 hours. So we're very happy to be able to offer that for you. Next question. Does that apply to spouses as well? Yes, it does. FMLA paperwork. So they basically find the diagnosis for you and use it to fill out your spouse's work to support you. So, yes. Postpartum care, because one day you will not be pregnant. Blood pressure check. If you had some blood pressure issues during pregnancy, we see you back in the office typically within a week of delivery. Incision check for my belly birth mamas, you're usually back in 2 weeks. Routine mental health screen usually occurs right after the 2 week mark because baby blues are very common. 80% of women will have baby blues. If those feelings persist beyond 2 weeks, we may be looking at postpartum anxiety or depression. And again, we want to get ahead of that. Postpartum doulas, because if they're there for emotional and physical support, when do you need that more than right after you have a baby? The motherhood space is a referral that some of you may get in the third trimester. If we anticipate postpartum anxiety and depression, there's a grant. Jacksonville is one of 5 cities in the country. And it's an amazing kind of mom play space downtown at the Y where they do yoga therapy, outdoor therapy, walks around the river, and you have psychologists and counselors for group and individual therapy. And it's all covered by insurance with childcare for babies 6 weeks to 12 years of age. And we love the motherhood space. And pelvic floor therapy is typically a routine here starting at 8 weeks postpartum. We have a nurse who comes in and is under our insurance certification. So if you're covered for me, you're covered for her. And she does 8 weeks of therapy, which is standard of care in Europe to help put things back together, whether you had a belly birth or a vaginal delivery. Either way, pelvic floor therapy helps you with all the discomforts of intercourse and leaking urine and all the things that, again, people don't talk about after baby. So random frequently asked questions, you can sleep on your left side, you can sleep on your right side, you can sleep on your back. If you're waking up dizzy from sleeping on your back, grab one of those wedge pillows off of Amazon and slide it under your back so you will not do that. You can help paint the nursery as long as you're in a well-ventilated space and or wearing a mask. You can take probiotics. You can dye your hair. I think that was the first question I had on here. You can do gel nails. Just if you're going to be sitting in the salon, you may want to put on a mask so that the fumes don't make you feel sick. You all will be pregnant over the holidays. So if you're planning to travel, car travel is fine up to 37 weeks. Just be sure you are getting out and stretching every couple of hours and drinking lots of water. Skincare, you can use your topical things unless they have retinol. So benzoyl peroxide, salicylic acid, those are all fine. Just nothing that has retinol in it. And flight is fine up to 32 weeks for my twin moms, up to 36 weeks for my singleton moms. Beyond that, like for emergencies, the airline is going to want a note from us. We just recommend, please, please, please wear your compression hose, the medium compression, and do your toe raises so that you're exercising your cows and drinking lots of water to make sure that you're not getting blood clots in your lungs or your legs. No roller coasters, no water slides. Those are the 2 main questions people ask here. And again, with my winter crew, you're probably not going to be doing a lot of those things anyway. And the next question is car travel up to 37 okay for twins? Again, that'll be on a case by case kind of basis. Like if you've been okay, and it kind of depends how far you want to go and whether or not you've had any signs of preterm labor or cervical shortening up to that point. So those will be closer to game day decisions. All right. Last thing is our COVID update. So vaccinations, the American College of Obstetricians said supporting women either way to strongly recommending it after a study of 35,000 women published in the New England Journal. Moderna and Pfizer are fine. We don't recommend Johnson & Johnson because it has an independent risk of blood clots. Booster vaccinations are fine for all of them if you're 6 months past your Moderna and Pfizer and you want to do one in third trimester in order to have antibodies to pass to your baby during breastfeeding. That is reasonable. If you're 2 months past your Johnson and Johnson, you can have a booster, but not of Johnson and Johnson. So mixing and matching is okay. You do not have to time them against flu vaccines, RSV, or Tdap because all of those work differently. If you do contract COVID, there are no formal recommendations for treating with ivermectin, azithromycin, or Plaquenil, so we do not recommend those. What we do recommend are one, don't come in here. One, don't come in here. Two, don't come in here. And three, please do not come in here with COVID. Convert to virtual appointments. It's just so contagious. And if you wipe out my entire front desk, you're going to be very upset when there is actually no one to answer the phone, even if you press zero. And it can happen. It happened in 2021. I was literally answering the phone, taking people's weights, and doing visits because I was the only one in the office who didn't have it. We recommend vitamin D3, zinc, vitamin C, and starting a baby aspirin daily until you're 36 weeks. If you contract COVID after 36 weeks, do not start the baby aspirin. We have seen increased rates of high blood pressure with people who've had COVID during pregnancy. So we do start with serial growth ultrasounds at that point. Next, supportive therapy at home. You only really need to go to the hospital if you have respiratory issues, like if you're having trouble breathing or a fever that you can't get under 101, then we recommend going to the hospital. For those who had your last baby during the height of COVID and you weren't allowed to have any visitors or anything, take a nice deep breath. We're back to our regular amounts before. 4 visitors plus your DONA certified doula are allowed to be in the room during labor. We're not routinely masking in the hospital anymore, only if you actively have COVID when you are in labor. And even if you do, we're not separating from your baby. We give you an isolette and N95 masks to protect your baby from the respiratory droplets. A couple of questions I have out here. Can you take baths? And yes, you can take baths. You just want to keep your water temperature under 101. Do you recommend a car seat belt adapter? So that may be something to ask your pediatrician. A car seatbelt adapter for you. So like an extension for a pregnancy, that would be fine. That's fine. I mean, it really just depends on where the belt hits you. It's supposed to go over and below a pregnant belly. So if it's not doing that, then an adapter is fine, or even a cushion. I have hypothyroidism. When should I start to get tested for my levels? That is something you want to talk about in your next visit. And the next question, my partner's last Tdap was in 2015. Yes. So if you're not exposed to a pregnancy every 10 years, but they do recommend it for each new pregnancy that you're exposed to. So yes, the last one in 2015, we're at the 9-year and we will be 10-year mark. So yes, needed again. Next question, I expect to get test results before my history appointment. How can I make sure those results don't include the sex of the baby? If we do before the history appointment, if you didn't talk to the person and tell them that you did not want the baby's sex to be revealed in that, then send a message to whoever ordered that to have them place that you just don't want it to be revealed. The next question is, are other children allowed in the room with the other parent? Yes, siblings are permitted to be in the labor room. And the next question is, so long as you don't feel dizzy, you can sleep on your back. Yes. Next question, thyroid again. Next appointment isn't until 14 weeks. Do I need testing before then? No. And again, if this is the same person who transferred in, you should have had thyroid checked from wherever you had your first labs done. All right, more questions? Okay, all right, no more questions. Oh, wait, maybe a few more are coming through right now. No, okay, fantastic. So that's it. We are social. So follow us on all the things. There's Facebook, there's X, there is Instagram, there's YouTube. YouTube is where you'll be able to find this later on. Okay, next question. Who should I reach out to if I do not receive my lab slip email? If you've already had your history and you have not gotten it by close of business the following day, check your spam for something from info@FullCircleJacks. If you do not see it still, then you can send me a message because I should have communicated what the labs were going to be to Naisha, our OB coordinator. And the next question is, should I just call the front desk? I'm not sure what this is referring to because I have several anonymous people out here. But if you can ask a little bit more on that question, calling the front desk about what, because several people have had some questions. But that is all I have today. Thank you guys for hanging with me. I appreciate all the questions today. This was a very talkative bunch. So thank you for your time. Thank you for hanging out with us at Full Circle, and we will look forward to seeing you guys back in the office really soon. Take care. Bye.